There are a number of factors that might cause daily headaches, and understanding the causes is key to finding a solution. It is very important first to recognize that there are two types of headache. In medical terms, we identify these as primary and secondary headaches. Primary headaches are headaches that are not caused by another underlying condition. Primary headaches include tension headaches, migraines, and cluster headaches. Secondary headaches, on the other hand, are headaches that are caused by another underlying condition, such as sinus infection, or a concussion, brain aneurysm, high blood pressure, panic attacks, panic disorders, and thunderclap headaches. Usually, these types of headaches are accompanied by other symptoms of the underlying condition. Now let's look at headache types, the symptoms they present, and possible solutions. 1. Tension headaches. These are caused by muscle contractions in the head and neck. They can be caused by a variety of factors such as stress, poor posture, depression, a head injury, or anxiety. Tension headaches are more common than you think, and many people are susceptible to this type of headache. Common symptoms of tension headaches include pain on both sides of your head, face, or neck. Feeling like something is pressing on your head or being tightened around it. The affected area may feel tender, and your head may hurt more when touched. If you suffer from tension headaches from time to time, consider doing activities to help you relax like exercise, yoga, and massage. Exercise can be really effective at releasing tension. As soon as you work out for a few minutes, the contractions you feel around your head will subside. Your muscles will relax, and as a result you will be relieved of a headache. 2. Migraine. These are a type of headache characterized by severe pain, often on one side of the head, and can be accompanied by symptoms such as nausea and sensitivity to light and sound. Migraine headache is actually classified as a neurological condition. It can affect children, teenagers as well as adults, and can progress through 4 stages: prodrome, aura, attack, and postdrome. Not everyone who has migraines passes through all stages. Prodrome. This stage occurs hours or days before the actual headache. Prodrome refers to the early stages and symptoms of any illness. You can look at it as a warning sign. Because at this stage, a person may start noticing changes in the way they feel, think, or behave. Symptoms may include changes in mood such as depression, irritability, fatigue, and a craving for certain foods. Second stage, aura. This stage is characterized by visual disturbances such as flashes of light or blind stops, as well as tingling or numbness in the face or hands. Auras are sometimes accompanied by a partial loss of vision referred to as a scotoma. The overall duration of the aura stage is about 20 to 60 minutes. Actual headache, or main attack stage. This is the most severe stage, characterized by a throbbing or pulsating pain which is made worse by movement, and typically occurs on one side of the head. Some people may experience it on both sides, or all over the head. Nausea and sensitivity to light and sound may also occur. The headache stage can last anywhere from a few hours to several days. Postdrome, the final stage. This stage is also known as the migraine hangover. Symptoms may include fatigue, confusion, and a feeling of weakness or sluggishness. Now let's look at possible solutions. There are a few things you can do to help reduce migraine symptoms. These include food changes and lifestyle adjustments to help you avoid these types of headaches. Diet can play an important role in preventing migraine attacks. Many foods and beverages may be migraine triggers, such as foods that contain monosodium glutamate, MSG, a flavor enhancer, alcohol, especially red wine, foods that are very cold, such as ice cream or ice drinks, aspartame and other artificial sweeteners, excessive coffee, baked goods with yeast, such as sourdough bread, bagels, donuts, and in some cases cheese. As you can see, there are a lot of trigger foods. Therefore, keeping a food diary to note what you ate before a migraine attack could be a helpful way to figure out trends and triggers. This way you can follow and track down your main triggers. Inhaling lavender essential oil may reduce migraine pain. There are several studies that support the use of lavender essential oil for migraines. Some studies have concluded that inhaling lavender reduces the frequency and severity of migraine attacks. Now look at this from a different perspective. It actually makes sense, because there is a link between anxiety and migraine in some cases. Anxiety is the most common mental health problem associated with migraines. A recent systematic review found the incidence of anxiety in migraine sufferers to be around 4 times higher than in those without migraines. This shows that, in some cases, migraines are actually caused by anxiety. Now let's look at what lavender is effective for. Yes, you are right, lavender is renowned for its ability to create a relaxing atmosphere. Lavender aromatherapy has been studied and shown to reduce stress and anxiety in patients. For example, in a 2010 study, lavender's anxiolytic effect was found to be superior to placebo in 221 patients suffering from an anxiety disorder. In addition, lavender improved associated symptoms such as restlessness, disturbed sleep, and somatic complaints, and had a beneficial influence on general well-being and quality of life. Migraine related to blood pressure. Another cause of recurring migraine attacks could be high blood pressure, also known as hypertension, but migraine disease can also put you at risk of developing high blood pressure. The relation of headaches to hypertension has been debated in the medical literature for many years. The most important thing here to remember is that you should keep an eye on your blood pressure when you have recurrent headaches. Consult your doctor if you find your readings to be high. Now let's move on to other types of headaches and possible solutions. 3. Chronic daily headaches. These occur on most days of the month and can be caused by a variety of underlying medical conditions such as sleep disorders. Lack of sleep and excessive sleep are both considered triggers for persistent daily headaches. Insomnia is more common among chronic headache patients. You can manage insomnia by creating a restful environment, managing your worries, exercising regularly during the day, and going to bed at the same time every day. If you're having trouble sleeping, you can make your bedroom dark and quiet. Hopefully, these tips will help you sleep better. Regular, adequate sleep will lead to fewer headaches. Other possible solutions include: try not to skip meals, reduce stress, reduce caffeine, and don't overdo it with medicines. 4. Sinus headaches. These are caused by inflammation of the sinuses, which can lead to pressure and pain in the face, forehead, and around the eyes. As a secondary headache disorder, sinus headaches can be associated with a wide range of underlying etiologies such as infection, anatomical abnormalities, trauma, and immunological conditions or sleep disorders. Seek medical advice to get to the bottom of this. 5. Cluster headaches. These headaches are a type of headache characterized by severe pain, often around one eye, and can be accompanied by symptoms such as a runny nose, sweating on the forehead, eyelid drooping or swelling, and watery eyes. The exact cause of cluster headaches is unknown, but cluster headache patterns suggest that abnormal activity in the hypothalamus may play a role. Cluster headaches do not usually have triggers, such as foods, hormonal changes, or stress, like migraines and tension headaches. But some scientists have proposed that they may be related to the sudden release of histamine, or serotonin, in the body. They could have other triggers such as drinking alcohol or strong smells, such as perfume, paint or petrol, smoking cigarettes, change to a high altitude, and bright light. Understanding your triggers could help you reduce or manage the occurrence or severity of your headaches. Disclaimer: if you are suffering from severe headaches, it is recommended that you seek medical help. This is because some of the causes could be due to more serious underlying medical conditions. If you have already had it checked and wish to get an overview of other causes, we hope you find this video useful and informative. Don't forget to like and share. If you are new to our channel, please subscribe by hitting the button down below to see future content. Thank you.